So you brought in Jonathan to get some help with what at our office?
With focusing, paying attention to detail, and then also being not as squirmy, or being able to sit still and just...
Okay. And then how long had he been having problems with these things, and how old is he now?
He is 14, almost 15. He'll be 15 in December. And he has been struggling with this since he's been a toddler.
Oh, wow. It's a long time then.
A long time, yes.
And you've used medications.
Yes.
But Jonathan didn't really want to use them.
No. He didn't understand it at first.
Right.
But once he did understand what he was taking, because eventually he asked, what is this? Is this a vitamin? Is this...
Right.
Because they're learning about drugs in school. And then once he realized what it was, and then he would question, why don't I have to take it this day? And it became easier to explain to him that we don't want him to be on the medicine at all times, because we need his body to take a break.
Right.
And we need him to be able to just let it out of his system so he doesn't get addicted to it.
And then Jonathan is on the autism spectrum disorder.
Correct.
Path. So he's a high functioning,
Very high functioning. Yes.
Asperger-ish
Correct.
kind of fella.
Correct.
And we've just completed a first few, how many sessions of neurofeedback?
Probably 13, 14
13
sessions,
or 14, okay.
Because we just did the...
We did a remap,
10,
and we had some about a 14% change.
Yes.
And then you told me that there was some really nice changes that you've seen. So can you recount those again?
Sure. One of the first things is that Jonathan pays attention to the time. He knows when he needs to come and do his homework. He doesn't need constant reminding to sit down and do it, or he's not complaining that he can't focus on it.
Right.
He actually comes down, sits down, and works on it and gets it done. The other thing that he's very much in tune with the other treatments and things that he needs to do on a daily basis in order to continue with his studies. And I was going to remind him, and I didn't need to, because he came into the room and said, I know it's time for me to do my next treatment.
That's cool.
So, yes.
So you said before you'd have to remind him to do his homework too, but he'd said he noticed he wasn't as focused.
Yes.
And so
he couldn't even sit down and concentrate. He knew that he wasn't focusing.
Right.
And so he would have to get up. He would ask for music to be played, or some other thing to keep him from being so distracted. Now he can sit. People can talk. His brothers can talk to him, and he will still be able. He'll tell them to go away because I need to focus on my homework.
Nice.
Yeah.
So now one of his goals was to start this school year without
medication.
ADD, ADHD medication.
Correct.
And so he did that.
Yes.
And he's
successful. Right now he is saying that he's telling us he feels more focused now than even when he was on the medication.
Beautiful.
So that is a huge improvement. We are so proud of him. And the other aspect that I wanted to touch on too is his eye contact and the type of conversations that we're having with him.
Right.
And what he's having with other people. His grandparents absolutely noticed the difference in him as well.
Yeah, because we noticed that pretty rapidly when he started coming here. It didn't take long for the eye contact to get much better.
Correct.
And for him to start carrying on some conversations with us even.
Correct. Oh, good.
Yeah.
Yes, good. Yes.
So that's good. So you happy so far?
Yeah, very happy.
Good. Well, we're glad you took the opportunity to learn about ClearMindSCMichigan.com.
This is wonderful.
Yeah, good.
Wonderful.